Good evening, live from ZTN studios in Harare, Zimbabwe. Welcome to The Chase, Zimbabwe's premier current affairs program. Our virtual discussion this evening, COVID-19 vaccine, safe or not? What is the plan? This is the first of a three-part series of programs on The Chase, focusing on COVID-19 and its impact on Zimbabwe. Good evening, I'm your host, Andy Hodges. This broadcast is brought to you by ZIMPAPERS TV network, ZTN, and our partners, the Nyaradzo Group, Plan International, United Nations Zimbabwe, and 1202 Herbal. To our millions of viewers joining us online throughout Africa, Europe, America, the Middle East, and Asia, we would like to hear from you, and we will endeavor to ask your questions directly to our panelists later in the program. Join this discussion on our Twitter handle at ZTN News and via our Facebook page, ZIMPAPERS TV Network. So make sure we hear your voice. Joining us in the studio, joining us this evening virtually to discuss COVID-19 vaccine, safe or not, what is the plan, are Dr. John Mangwiro, he's Zimbabwe's Deputy Minister of Health and Child Care, Dr. Alex Gasasira, WHO Country Representative, Dr. Ruth Labode, Chairperson of Zimbabwe's Parliamentary Portfolio Committee on Health, Dr. Shingai Nyaguse Chiurunge, President of the Senior Hospital Doctors Association. Welcome to The Chase. Now, to our esteemed panelists, you will be asked to respond to a question and given 2 minutes to make your submissions. Now, should you wish to briefly comment on other guest submissions, please wave and I will come to you. Please keep your responses brief, civil, yet vibrant. Our values at ZTN are dignity, dialogue, and debate. Before we begin our discussion, ZTN decided to go into the streets of the capital city of Zimbabwe, Harare. And here's what some citizens think of the COVID-19 vaccine.
Ngatoida zvachose asi chinoda kuti ngaitambire kuma airport uko nekuma borders first vanhu ivavo vapiwe vaccine.
Pachangu nemhuri yangu andi kana muzukuru wangu chaichayo ndakatotaura ini ndakatotoreteswa ndirochwani ndakatoreteswa ndichoudzwa kuti pane mushonga uri kuuya zvakatonziramba musabaise kana mwana kana chii ndakatorota ndichoudziwa.
Vaccine ikauya ini ndakatoida ndakatoimirira ndatononokera pane vamwe vakatofa vakatoishayiwa.
Tinongobayiwa todzivirirwa kuti tikwanise kunzi hatichaende palockdown takwanisa kushandawo zvakanaka.
Those are some interesting comments from citizens on the streets of the capital city of Zimbabwe, Harare. Now, let's get into our discussion. John, conspiracy theories and fake news have bombarded the internet over the COVID-19 vaccine. Among these, BBC News footage was passed off as proof that COVID-19 vaccines are fake and that press events showing people being injected had been staged. A story about a nurse dying after having taken the vaccine went viral on Facebook. The story was later proved to be false. So let me ask you this, sir. Is the COVID-19 vaccine safe and should Zimbabweans trust it? Dr. Mangwiro, can you unmute your microphone, please? Deputy Minister, please can you unmute your microphone?
Yeah, now you are hearing me now.
I can hear you, sir. Please go ahead.
Yes, I'm saying this type of discussion is very good. The COVID-19 vaccine, we start with the disease itself. It was discovered by scientists who then gave us information as to what type of disease it. COVID-19 was named by the World Health Organization president. So everyone knows that we should follow things scientifically and correctly. The COVID-19 vaccine is a vaccine that is being discovered by scientists and people who are towing the line to say we should do things correctly. So most of these vaccines undergo thorough check from our medical and from our Medicines Control Authority of Zimbabwe. The people who are producing the vaccine will also send us figures and papers to prove that the vaccine is okay. So, and before it gets to the people, the vaccine is tested and to make sure that it's safe. And this is done by our wing of these drugs, MCAZ. So in short, we are following science, we are doing science, and we need to say to people, we wouldn't distribute anything that's dangerous to the population. And this thing is important because it was done by scientists who discovered the disease, and this vaccine is coming up again by scientists. But to say that, is it safe or not? That's the truth, that if things are proven scientifically, and here in Zimbabwe, our specialists and scientists are happy, then we go ahead and give it. So far, we've been moving along with the whole nation or with the whole world. And we think these vaccines, those who deserve it or who need to take it, people must just get it. Sure.
Alex, you work for the WHO, and of course, you're on the forefront of obviously testing and making sure that the vaccine is proper. So let me ask you directly, is the COVID-19 vaccine safe? And furthermore, can citizens face any potential side effects or harm if they take it?
Thank you very much, Ndi. Since this pandemic declared, manufacturers, scientists, researchers have worked very hard to bring us tools, to bring the world tools to bring this pandemic under control. And one of the tools that people have been working very hard on are vaccines. Now, the vaccines that have been developed in different countries have gone through the same stages of manufacture as all the other vaccines that the world has been using over the last 4 decades. And all the steps that are needed to ensure that a vaccine is safe and effective have been respected. In addition to the steps from the manufacturers, there are independent regulatory processes, as the Honorable Deputy Minister has just told us, at different levels. At global level, WHO offers this service for countries, but the other stringent regulatory authorities in different parts of the world do offer this service. And then every country has its own national regulatory authorities, as we have had the MCAZ here in Zimbabwe. So all these processes have been and continue to be applied in terms of the COVID-19 vaccine. And we also have independent scientists making policies for us. So all the vaccines that have passed through this process are safe and effective for use, and our people should be comfortable. And I do believe there will be opportunity for these processes to be described in further detail.
Alex, COVID-19 doesn't kill anybody in Angola, as we are immune due to malaria. So goes one of the many falsehoods about the pandemic in the Southern African country. Misinformation and rumors have constantly cast a pall on the fight against COVID-19. The World Health Organization, WHO, office in Angola and the Angolan Ministry of Health set up the COVID-19 Alliance, a system to fight the surge of potentially harmful misinformation shared mostly online. Are you working on a similar system in Zimbabwe to try and get rid of the misinformation that is flying around?
Thank you very much. As the World Health Organization, we support the government, the Ministry of Health and Child Care, and work with other stakeholders from all parts of society to pass reliable, correct scientific information to everybody, so that people have the right information to guide their decision making. So yes, a lot of work under the leadership of the Ministry of Health and Child Care is already ongoing here in Zimbabwe.
Ruth, I'm sure your Parliamentary Portfolio Committee on Health has discussed the COVID-19 vaccine and if it is safe or not. What were your conclusions, and would you encourage citizens to take it when it does eventually reach Zimbabwe? Dr. Labode? Can you unmute your microphone, please?
Thank you. As you know, we are in lockdown, so Parliament is actually in lockdown. We are at home and we are in recess. And we have not discussed the vaccine. But we know, we read, I've been on so many webinars, even with the AU over the vaccine. as a chairperson from home, I would encourage every Zimbabwean. And I have gone on so many webinars, local on radios, and I've told the nation that if need be there, I'm willing with my family to be the first one to be tested so that everybody will know the vaccine is okay. We will, and we intend to campaign to urge our people to go and be vaccinated.
Shingai, thank you, Dr. Labode. Shingai, was your association consulted in any way with regards to the vaccine? And furthermore, from your own investigations and knowledge, would you say that the vaccine is safe and citizens should in fact take it without fear?
Okay, thank you, and thank you once again for the invitation to join this panel. As an association, we were not approached as an association, but there are various specialists who are involved in the National Task Force and the National Technical Working Groups, which are giving various levels of advice to the Ministry of Health, to the National COVID Task Force. So, as we know, it's this is as Honorable Dr. Mangwiro said, this is a very important conversation because this is very new. A lot of it is new technology. The vaccines have come out in record time, and a lot of people are skeptical, and rightly so. So, because all these vaccines are relatively new, the follow-up times are relatively short. It's not like the measles vaccines, we've got decades of data. So for our most COVID vaccines, it's 3 to 4 months follow-up times that they're reporting on. And if I'm not mistaken, there are more than 100 million doses that have been administered so far worldwide. And there have been reports of adverse effects, the majority of which it's a very small percentage, and the majority of which have been mild. So it's important for people to know that these things can happen. Things like fatigue, fever, headaches, pain at the injection site, myalgia, muscle pain. There have been a few reports of what they call serious adverse effects in some countries. Things like hemolytic anemia, transverse myelitis. But I think for doses of over 100 million, the number of adverse effects that have been reported so far, you can count, and they are very small compared to the number of doses that have been administered.
We now welcome another guest on the chase. In fact, we couldn't get him earlier, but we managed to get him on the phone, and that's Prince Mutandi, or Sekuru Sibanda. He's Secretary of Education at the Zimbabwe National Traditional Healers Association, ZINATHA. Sekuru Sibanda, is there a role for traditional medicines in the fight against COVID-19? Is there, in fact, a tried and tested and safe traditional medicine alternative or treatment that can counter some of the effects of COVID?
Yeah, with the traditional medicine side, yes, traditional medicine side, we actually, traditional medicine is not, it's not as new it has existed before this modern science. So we are quite sure that with our traditional medicine, which with the number of species, we've got 5,000 species in Zimbabwe, whereby we look forward, out of the 5,000, 2,000 to 3,000, they have got some medicinal properties. Whereby, if we are to go and try to find out how these plants which we have in Zimbabwe, we can be able to contain this kind of disease. So, with the traditional medicine, I'm sure we are quite sure that we have medicine which is able to combat this pandemic, but it's only that it's being traditional medicine is being sidelined in that sense, because even with the vaccines which you are talking of, yes, we do have the traditional medicine.
But Sekuru Sibanda, though, let's be clear, though. As we talk today, there are no traditional medicines that can be taken as a vaccine against COVID-19. I mean, you're talking about that they possibly could be there and more research has to be carried out. But as of today, there is not the traditional medicine remedy against COVID-19. Is that correct or not?
Yeah, with this matter, we had officially launched we've got another herb which we know, which is able, which is guchuken, which we are selling. It's only that with the traditional medicine, people they need to learn about how to use the medicine, because there are some problems that people they just heard. If people are talking about Zumbani, yes, we have got also better medicine. So if we are given enough time, if it is like we go through all our traditional herbs, our herbs which we have in Zimbabwe, I know we could come up with herbs that can be able to contain this disease. But with the vaccine which is coming, yes, we accept that, yes, but we accept the use of the vaccine, but we don't know how safe it is, because we are used with our own traditional medicine. And somehow we are becoming too skeptical about the use of this vaccine. But it's good for to save our people, but to save lives. But with the traditional medicine, we need even the WHO to try and develop this indigenous knowledge, because we are just only looking on the Western people, or even on the Western side, without taking care of what we have at our home, because we do have the herbs that are able to cure, which is within our own places. Yeah. But we don't have time to
test them and to see whether there is a remedy. Okay, thank you, Sekuru Zabanda. You're watching The Chase, our virtual discussion this evening. COVID-19 vaccine, safe or not? What is the plan? This is the first of a three-part series of programs on The Chase, focusing on COVID-19 and its impact on Zimbabwe. This broadcast is brought to you by ZIMPAPERS TV network, ZTN, and our partners, the Nyaradzo Group, Plan International, the United Nations Zimbabwe, and 1202 Herbal. Remember, we would like to hear from you, and we will endeavor to ask your questions to our panelists later in the show. Join this discussion on our Twitter handle @ZTN News, or via our Facebook page, ZIMPAPERS TV ZIMPAPERS TV Network. So please make sure we hear your voice. It's time for us to take a short breather. So don't go away. The Chase will be right back.
Losing the person I loved the most was one of the hardest things I've ever had to face.
And because I was away from home, it made it much more difficult.
That is when I saw how important it is to have a friend.
A friend to ease the burden.
A friend to take care of things when you can't.
A friend to help you get home.
Welcome back. You're watching The Chase, live from ZTN studios in Harare, Zimbabwe. Our virtual discussion this evening, COVID-19 vaccine, safe or not? What is the plan? John, the African Union has secured close to 300 million COVID-19 vaccine doses in the largest such agreement yet for Africa. That's what a continental spokesperson said last month. And the vaccines have been secured from Pfizer, Johnson & Johnson, and AstraZeneca. Reports indicate that Zimbabwe will receive around 2.5 million doses. So does Zimbabwe have a vaccination rollout plan? If we do, what is it? And when will it commence? And will it be compulsory or not for citizens to take the vaccination? And is there a priority list, for example, healthcare workers first? What are your comments?
Thank you. Yes, the AU, we are a member of the African Union, and we work very closely with the African Union. And having bought for all countries in Africa this vaccine, we know very well we must contribute to it. That contribution should be handled by the Minister of Finance, but the Zimbabwean government really has got a rollout plan already. We actually know very well that our hospitals and clinics are ready for that. So when we roll out the vaccine program, we are going to be following our laid down channels and our laid down methods of planning. And then you are going to get a statement very soon, I'm sure, from the head of state about the rollout program and when it's going to start. But we are at an advanced stage, I must say, to get the vaccine home. And definitely the rollout plan is there. And then about priority list, definitely there's a priority list. We will start off with our frontline workers, the vulnerables, and the aged. Then we will have a cutoff for the ages, and the frontline workers, we need them alive and they should be able to perform their duties safely. So I can say to you that we are working very closely with the AU, and we are almost there. Like I said, the rollout plan is there. Then we treat the people, or give the vaccine to the people, frontline workers, vulnerables, and aged. I'm saying it for the second time. I think that's quite the short and the long way.
And will it be compulsory to take it? Because reports are that a nation needs to vaccinate at least 40% of their population to at least eliminate the spread of COVID-19. So compulsory or not?
No, it's not compulsory. People will volunteer to get the vaccine.
And with regards to the vaccine held by the African Union and from other sources, has Zimbabwe paid and secured it already? And when can we expect it to be delivered in the country?
Yeah, like I said, we work very closely with the African Union, and whatever money is required, say, to pay for the vaccine or anything in the African Union, we have to look for the money and make sure we pay for whatever the vaccines are. That part is being handled by the Minister of Finance, that of raising funds or looking for the funds. But definitely, we are very interested, and the Minister of Finance will tell us shortly how far they will have gone about looking for the money, about 25 million, I guess.
And Deputy Minister, you heard my statistics, and these are reports given that 40% of the population needs to be vaccinated in terms of trying to get the COVID-19 under control. So if it's not compulsory and Zimbabwe citizens don't come forward to take the vaccine, how do we reach that threshold? What would then be your ministry's plan?
Yeah, what is needed in any situation is crucial and critical like this. The Honorable Labode has just said it. We need a lot of awareness to make people aware how good this is.
Okay, thank you. Alex, looking at rollout plans already in place in other countries that have already secured the vaccine, what can Zimbabwe learn from them to make our rollout plan successful and to ensure that we vaccinate as many of the population as we can?
Thank you very much. Indeed, Zimbabwe has, in the recent past, rolled out other new vaccines that have been recently introduced into the National Immunization Program. So Zimbabwe has a lot of experience in introducing new vaccines. Key elements of the rollout plan that the Honorable Deputy Minister mentioned include having effective coordination mechanisms, ensuring that all stakeholders are part of the process and there's adequate information sharing, consultation, dialogue, as Honorable Labode mentioned. Ensuring adequate cold chain, ensuring health workers are trained, ensuring that there's a system to monitor people after they take the vaccine. So all these are part of the process, and I'm aware that a lot of work is already going on in these areas with support of different parties.
Thank you. Ruth, the Zimbabwe government has said they have secured $100 million for COVID-19 vaccination payments. They say this will vaccinate over 60% of Zimbabwe's population. And of course, Zimbabwe's close friends, China and Russia, have also stated that they will provide vaccine aid to Zimbabwe. So your committee, Parliamentary Portfolio Committee on Health, has it advised the government on the best strategy for the vaccination rollout? Also, where and through what channels it should be administered to citizens?
That's not the responsibility of the Committee on Health, really. We are not an implementing agent. The implementing agent is the Minister of Health. Our role, for me, I would want to applaud the minister for actually committing 100 million. That would be a galvanizer for partners, for our usual partners, to come in and help us. So for me, Minister Mtuli Ngube has done very well. But what disappointed me is I agreed with him when he said certain members of the society will have to pay for the vaccine. I, for one, would have thought medical aids, for example, politicians should pay, even if it's just $1, $1 converted at the auction rate. You pay that, then we are able to actually recoup the money and invest and buy again. Because of course 100 million is not enough. Yes, we do have partners, but still, for us to be able to get enough vaccines, because I believe we will actually get more than 60% of Zimbabweans coming out there. They are already crying out that why are politicians wanting to vaccinate themselves first? And that should be the strategy that we should use. Vaccinate 360 MPs tomorrow. Everybody in the constituency will go for the vaccine, but we won't have the vaccine. So, Mangwiro, you need the medical aids to be able to refund me for the $1 I've spent for the vaccine. It's important, and we need also, we have companies, the private companies should be able to pay $1 pay. If you have 600 workers, it's 600 US. It's not a lot of money. Everybody must come into this game, and we ensure that it happens. Partners follow political commitment and national commitment to whatever.
We will ask the Deputy Minister later in our show whether Zimbabweans will pay for the vaccine or not. But before we get there, Shingai, there appears to be many COVID-19 vaccines emerging in the market. These include vaccines from drug maker AstraZeneca PLC, Pfizer BioNTech SE, Johnson & Johnson, Novavax, Russia's Sputnik 5, and a vaccine from China's Sinopharm Group Limited. Is there any evidence, to your knowledge, which may be the best vaccine for Zimbabwe?
Okay, I think one of the first things we would need is to actually, for the ministry and the laboratory side, the laboratory pillars, to actually tell us which is the dominant variant that is circulating in our community at the moment. Because that's one of the most important things to inform, or which will inform which is the best vaccine to go for. Because as has been reported recently, they're showing various efficacies because there have been several mutations. And some of these mutations have been on very important parts of the virus, which are important in generating the immune response once a person is vaccinated. So I think that is one of the first steps and most important steps, of which I'm not sure why it is it hasn't been made clear which variant is dominating currently. In terms of the best vaccine, apart from our local variant, is I can say from my knowledge, the manufacturers who have published their data for peer review, what we call peer review, they've given their study protocols and all their data for other people, other independent scientists to analyze, will be the Pfizer, Moderna, and AstraZeneca. From what I understand, Johnson & Johnson and Novavax will be publishing soon. But the Sinopharm and the Sinovac, from what I understand, have not really published all of their phase 2 and phase 3 data for independent analysis. So the mRNA vaccines, of course, are showing the highest level of efficacy, although there have been some adverse reactions in the elderly and frail population because of the strong immunogenic response that they are eliciting. AstraZeneca, from our assessment as an association, we'll probably be leaning more towards AstraZeneca and the Johnson & Johnson. Again, as Dr. Gasasera pointed out, the issue of the cold chain. As you know, the mRNA virus vaccines are requiring extreme temperatures for storage, cold temperatures, of which we would require a bit of infrastructure development on our side to maintain those vaccines, which is, a lot of money and a lot of time. So from our assessment, one, the variant; two, our ability to maintain the vaccines, the cold chain of the vaccines, of which the AstraZeneca, the Johnson & Johnson, and the Novavax seem more amenable to our environment. And as I said, the Sinopharm and the Sinovac are showing quite variable efficacies in the trials that have published. Some are saying 50%, some are going as high as 83%. But again, their data has not been published for independent analysis.
We will ask we will ask the Deputy Minister about the cold storage issue again later in the show. But before we get there, Johnson & Johnson, which is one of the major makers of the vaccine around the world, did issue a statement last week, and they said that their single-dose COVID-19 vaccine reduced rates of moderate and severe disease, but the shot appeared less effective in South Africa, where a new coronavirus variant had become common. And listen to these numbers, sir. Overall, the vaccine was 66% effective at preventing moderate to severe disease 28 days after vaccination. But efficacy differed depending on geography. The shot was 72% effective among clinical volunteers in the United States, 66% amongst those in Latin America, and just 57% amongst those in South Africa. So let me put it to you, sir. Which vaccine from the many on offer is Zimbabwe likely to get? Deputy Minister, can you unmute your microphone, please? Deputy Minister, I think...
Sorry,
no problem, sir. Please continue.
Now you can hear me.
Yes, I can hear you. Please go ahead.
As the government and as a ministry, we are led by science. We will look at the clinical phase of the vaccines, clinical trials, and also the cold chain, which one is easier for us. So we have all that data to say, look, we have the vaccines that can be stored from 2 to 8 degrees Celsius, minus 75. We will actually follow what our scientists come up with, including the virus, which one is really dominant, and we are going to use that as a guide to our vaccination program, which is going to be underway very soon. So the vaccine, you know, there are many on the menu. So it depends. We'll also look at what is best for us using our experts and all that. And we do not say we'll take this one and leave that one. We'll just look at each vaccine independently, its performance, and when it can be delivered and how it can be delivered, ease of storage and all that.
John, let me continue with that question, because you've heard my other guests talk about the cold chain, because it appears that getting the vaccine is just the first step. There's the issue of the COVID-19 storage problem, with most countries on the continent only equipped with a cold storage chain that can maintain standard refrigeration temperatures of -8 degrees Celsius. Commentators fear that much of the vaccine may go to waste. If you look at the other companies, Pfizer and BioNTech's candidate vaccine must be transported at -70 degrees Celsius. The Johnson & Johnson and AstraZeneca vaccines, on the other hand, do not seem to have that cold storage requirement of the other vaccine. So what is Zimbabwe planning to do about this when the vaccine comes? What arrangements have been put in place to get it into the country, bearing in mind the cold storage issue, and also getting it out to rural areas, particularly when we will require infrastructure to keep it cold, in some cases at -70 degrees Celsius?
Yes, and I must answer you this way. As a country, we have been doing expanded programs of vaccinations. We have a continuous cold chain from as high as the general hospitals, our district hospitals, and the clinic. They have a method of keeping our vaccines viable. So like I said at first, we are ready. When they come, we will send them through the same chain, which is locally available already. We do not want to say we take something that we cannot keep or the quantities that we cannot keep. We have calculated to say how much can our central storage facilities store, and when the vaccine arrives, we will send them according to the cold chain that is already there in the country. So that's why I said that we will choose the vaccine that goes with our local environment. We know our cold chain, which is there already. We have been using it for years to vaccinate children, and we have also been vaccinating for a long time for many things. So it's easy for us to get a vaccine that's suitable for our environment and our storage facilities, Andy.
Thank you. Sekuro Sibanda, many Zimbabweans, as you yourself have stated, still use traditional medicine in their daily lives all across the country. So I just want you to clarify, would your organization advocate that Zimbabwean citizens take and use the COVID-19 vaccine?
Yeah, for Zimbabwe, for the sake of the people, yes, what we need, must integrate the two systems. Because traditional medicine, we should not put it aside. Let's integrate the two system, because we have got also people who are also getting, they also having also getting help from the traditional medicine side. Our traditional medicine side has got also an integral party. So we should also try and give it a room. So they should give us also space for the traditional medicine. We know, yes, the vaccine, yes, we do allow it, because with the pandemic, yes, it's good for people that they should be vaccinated. But we should not also put away traditional medicine, because traditional medicine has got also an important role.
Yeah, thank you. Shingai, you wanted to respond to the issue about the cold storage chain. Do you have a comment? No, sorry, Sekuro, I'm asking about to Shingai. Thank you. Shingai, please go ahead.
Not so much about the cold storage chain, but about the typing, the circulating virus. As you know, you know, a lot of our population, we have a lot in UK, and we have a large contingent in South Africa. And many people came over in December. And I think if you've seen the rate at which these mutations are taking place, the UK is saying, you know, it's 40 to 80% more transmittable. And the South African variant is said to be, you know, escaping the antibodies. So, you know, I just wanted to emphasize that it's very important that we start typing and that we start sharing this information with the wider medical fraternity as well.
You're watching The Chase, our virtual discussion this evening, COVID-19 vaccine, safe or not? What is the plan? This is the first of a three-part series of programs on The Chase focusing on COVID-19 and its impact on Zimbabwe. This broadcast is brought to you by ZIMPAPERS TV network, ZTN, and our partners, Nyaradzo Group, Plan International, the United Nations Zimbabwe, and 1202 Herbal. Remember, we would like to hear from you, and we will endeavor to ask your questions directly to our guests later in the program. Join this discussion on our Twitter handle at ZTN News and via our Facebook page, ZIMPAPERS TV network. So make sure we hear your voice. It's time for us to take a breather. Don't go away. The Chase will be right back.
And receive
Studios in Harare, Zimbabwe. Our virtual discussion this evening, COVID-19 vaccine, safe or not? What is the plan? Alex, we've been discussing here the issue of cold storage, which is critical in ensuring the vaccine reaches as many people as possible in its optimal condition. So what does the WHO advocate and advise that countries, especially in Africa and Zimbabwe, of course, should do to bridge this apparent logistical gap? Is there one, and what should they do if there is?
Thank you very much. The WHO has recommended cold chain assessment, taking into account the different needs of the different vaccines as has already been described. And there's a standard tool that countries, including Zimbabwe, have already used to identify what may be needed, what is available where. And again, this information is shared with the WHO and other partners. And we believe that this would also be a basis in case some gaps have been identified for plans to strengthen the cold chain. Thank you.
Thank you. Ruth, you heard what the Deputy Minister of Health and Childcare said about the logistical or the infrastructure that's already in place in terms of cold care for storage facilities. And I mean, your committee is very up to date on what is there around the country. So your comment, does Zimbabwe have enough cold storage capacity to be able to get the vaccine out effectively to all corners of the country? Can you unmute your microphone, please, Dr. Labode? Dr. Labode, can you please unmute?
I was saying we actually haven't done oversight.
Please go ahead.
Okay, I was saying we have not actually done oversight. We have not done oversight over the cold chain logistic management in Zimbabwe of recent. Those specialists, we had an excellent cold chain management once upon a time. So I'm believing that the minister, that it is based on our immunization coverages, the cold chain must be in order. And I think not for every vaccine. I'm hoping the university or whoever, the technical group that is looking at the vaccine itself should advise the ministry which vaccine is, and WHO, which vaccine is suitable for our cold chain management, what exists in Zimbabwe. We shouldn't actually be banking on buying a lot of new things because I don't see that happen. I know Econet used to help in the cold chain management in some of their centers, like in Pinga.
Thank you. Thank you. Shingai, it would appear that your members will be in the front line together with other health professionals in carrying out the vaccination of Zimbabwean citizens, I think, as the minister said, using our existing network to do this. So I have a couple of questions. When was the last time such a wholesale vaccination program was carried out in Zimbabwe? And if there was one, how long did it take? And does the health sector have the capacity to carry out vaccinations for almost 10 million people, if not more?
Okay. I must say, actually, traditionally, our members are actually not that closely involved in actual vaccinations. We're more on the treatment arm. But definitely, like you said, this is a unique situation, and members will definitely avail themselves if called upon to assist in the rollout. And again, as Dr. Laborde has mentioned, we've had a very effective immunization program throughout I think Zimbabwe has previously always been cited as having one of the best immunization programs on the continent. But what usually happens is, introduction of a new vaccine. Like recently, the latest was the HPV, for cervical cancer. Usually, we pick a pilot districts, or a few districts, 2 or 3, to pilot the vaccines in. You study it carefully, then you roll it out gently, monitoring at every stage. But of course, this is a unique situation. This is a global pandemic with virus mutations occurring at quite a rather alarming rate. So I don't know if, unfortunately, the rollout plan has not been widely shared. I guess the minister would have more information, but I don't think we would be in a position to take the amount of time that has traditionally been done between the pilot studies and the national rollouts. I don't think, of course, I stand to be corrected, but I don't think we've ever embarked on a 10 million vaccination program. But the immunization program has had a lot of experience in mop-up days and launching of new vaccines. So I think it's just a matter of scaling up and coordination, as Dr. Gasisira said.
John, let me come back to you, because I think these are vital questions, and I have 2 questions really. The first one is that you mentioned earlier that Zimbabwe does have a rollout plan and that it's there and in place. Possibly you could briefly share that rollout plan with us, or at least advise us when Zimbabweans will finally get to hear about it. And of course, my second question is, 10 million people, John, is a lot of people to vaccinate in a very short period of time. Can the health sector manage to do it in the time allocated that it has to be done in?
Yes, Andy, the rollout plan, like I said at the beginning, an announcement will be made very soon so that we can share everything with the public. And the rollout plan and the vaccination will be done stage by stage. There is no way we can say we vaccinate 10 million people at the same time. We are going to start with a certain group of people, we go over it, and then follow another group like that. So this vaccination program is not going to be a wholesale one. And we are going to say anyone who can help us in the medical fraternity to give out the vaccine, we will be very grateful. But it should be done in an orderly manner where we can also have data that we can be able to follow up after the vaccine has been given. So the plan is that the vaccine will be given, but it has to be done systematically in a safe manner, with the vaccine being kept in a safe environment. And the scientists and experts, they have sat down and found that we need this particular vaccine, and we choose among us the whole bouquet of them. And then we start, and we are quite aware that we cannot do it overnight. It's a program that's going to be sequential and step by step.
Sekuro Sibanda, I want to talk about communication and, of course, advice to citizens. would you agree to use your members or your organization to spread the word to citizens, especially in rural areas, information about the vaccine, and that you actually do endorse them taking it? Would you be willing to do that as INATHA?
Yeah, with this matter, we are willing because actually we have to integrate the two systems. It's not like we are to try and say, no, with this more biomedical system, we no, we want the two systems because we want the better side of the people, the good health of the people. So with this matter, as we are, our side, yes, with the traditional medicine, you know, it's somehow bound with the cultural practice. You know, it's only that we don't, people are not giving enough time for the traditional medicine side for them to check and see how we do with our traditional medicine. But as Zinata, we can spread the information about, we can also make people we can campaign for people also to be vaccinated. We like it because we want for the good of the people. People have got their choice also, but with the traditional medicine, we need to develop our traditional medicine because the type of medicine which we live with is the one that cures us. All the traditional medicine which is in our garden, in our country, is the one that cures us. Not these vaccines that comes out where we don't know, because these people where they manufacture the type of climate where like the climate they have in China, like it's different from Zimbabweans here. With the trees which we live with is the one that saves us. So we are connected with nature. Actually, our God knows it. So we also try to encourage also people not even to shun about the vaccine, but they have to take it. We like it.
Thank you. You're watching The Chase, our virtual discussion this evening. COVID-19 vaccine, safe or not? What is the plan? This is the first of a three-part series of programs on The Chase, focusing on COVID-19 and its impact on Zimbabwe. This broadcast is brought to you by ZIMPAPERS TV network ZTN and our partners, the Nyaradzo Group, Plan International, the United Nations Zimbabwe, and 1202 Herbal. It's time for us to take a breather. Don't go away. The Chase will be right back.
Where we are this evening.
Safety. And are you working with such groups like ZINATHA to make sure that the word and the educational aspect of the COVID-19 vaccine is spread to as many people as possible in the shortest periods of time? Oh, okay, all right. Unfortunately, we have lost the Deputy Minister, but we will be getting him back. Alex, let me ask you this. I'll come back to Deputy Minister just now. But Alex, you've had vast experience working in Africa. What would you say is the best way to communicate issues surrounding the vaccine to Zimbabwean citizens?
Thank you very much. Well, in vaccination campaigns of such a nature, we recommend a multiplicity of platforms to communicate such information. The media, like where we are this evening, interpersonal communication channels, communication by health workers at the lowest level, use of influential leaders and community members, as you mentioned just now, ZINATHA. They are the service providers for a large portion of our population, and they can be an effective channel for disseminating such information. I would just like to compliment what Shingai said earlier in the program about recent vaccines that have been introduced. We may remember that in 2018, when we had the large cholera outbreak that affected Zimbabwe, one of the interventions that was used was the oral cholera vaccine in the most affected parts of the country at that time. And again, Zimbabwe did this very, very successfully with a lot of participation, and over 1.2 million people were vaccinated. So this experience is available. We will, of course, be talking about a different vaccine, but the channels and the experience is available in the country. Thank you.
Shingai, health professionals are held still in high esteem by the generality of the Zimbabwean population. Can doctors and health professionals also get involved in the education of citizens with regards to the vaccine and also, of course, to the rollout plan?
Definitely, I think the healthcare workers and doctors in particular are a very important stakeholder. And in that regard, I would really urge the ministry, unfortunately the deputy minister has dropped off, but I would urge the ministry and those in charge to be more forthcoming with information, especially things like the rollout plan. I think the medical fraternity is a very important resource. It would be good to have some kind of feedback channel because we are going to be such an integral part, even as you say, in educating. We're potentially important advocates for the government plan to begin sensitizing other healthcare workers and the population in general, if need be. We also, I think, would play a role even in following up on research. There's so much being published that I don't think there's any one organization, one individual who can keep up with the level of data that's coming out. I think Dr. Gasisira can confirm that there's so much data being published on a daily basis. I think the medical fraternity is, if there was some kind of feedback mechanism to feed into even to the technical working group, to the minister, to be able to synthesize the important information. As we say, this is new technology. Data is coming out every day as they are rolling out, like especially from South Africa, who are our close neighbors. We need to be keeping a close eye on things that they are publishing. Some information is just coming out, in small journals, even on various group chats that we as medical professionals are on. There's some information that can be coming out there that may not reach publication level, but which would be important, for us to capture in real time. So yes, we definitely have a role. I think if the ministry was to share their plans, get input, we would be an important stakeholder in educating the public and in advocating and also protecting our patients, because like we said, it's new technology and people's genuine fears must be acknowledged and must be addressed, not swept under the carpet.
I did want to ask the Deputy Minister this question, but unfortunately he has dropped off. And it was about the clarification of the official government's position on whether citizens of Zimbabwe should pay for the vaccine or not. However, we can report that this afternoon, the President of the Republic of Zimbabwe, His Excellency E.D. Mnangagwa, stated officially that Zimbabwean citizens will not pay for the virus. So I suppose that is good news in terms of citizens who are worried about if they could afford or not to pay for the vaccine. Now, Ruth, one area which is of great concern, of course, is the area of corruption. And what would you advise, not just as a parliamentary committee, portfolio committee chairperson, but also as a doctor in your own right? What would you advise the government to do to stamp out corruption? Because you can see that there could be opportunities in the vaccination rollout for people to try and take advantage of the system to make money. What would be your advice? Sorry, can you unmute again, please, Dr. Labode?
Sorry. I'm saying in the case of the vaccine, I don't see personal room for corruption, because this issue, unless jumping the queue, that is likely to happen. And I was going to give the question to Alex. Alex, I've been observing the American situation, the logistic difficulties of actually vaccinating people, lack of vaccines in America. So I'm worried that we seem to be wanting to we are mobilizing people for something that may not be there. I'm not saying vaccines will not be there, but they will not be enough. And my concern with that is it will seem as if there are certain people who were vaccinated and we all knew all along that we did not have enough resources. If America doesn't have enough resources, Europe is struggling. They are failing to produce enough vaccines or a financial issue, I don't know. But my concern is we will go out there and get people to come. The corruption that Andy is trying to talk about that can happen in the vaccine is only one jumping the queue. Nobody can take the vaccine. It needs a cold chain. So you can't keep it anyway. It's not a sweet or a drug. You can say you can take and sell to the next person because you would have that cold chain to be able to carry it from avenues to another hospital or something like that. So my concern really with WHO is you know very well how much money is available, how many doses are available for Africa, for Zimbabwe. How many, can we really cope? That's what I want to know. If the numbers come out, people come out in numbers, and they will, trust me. I talk to people every day. I'm on numerous groups. There is such a demand. Everybody's saying, whatever it is, Americans and others have taken it, let's take it and die.
Alex, you heard Dr. Laborde. Is there any, can you respond to some of her questions or some of her concerns about the Zimbabwe's capacity to be able to inoculate, to vaccinate 10 million people when other countries, even first world countries, are struggling to do exactly the same?
Thank you very much, Andy. Thank you very much, Honorable Laborde. In fact, the biggest rate limiting step is going to be in the supply, the availability of vaccine. You're absolutely right. What we have seen in the countries that have already started vaccinating, as you mentioned, in the United States and Europe, the manufacturers have a projected amount that they believe they will be able to produce in a particular period. And what we have seen is that in many instances, they have not been able to reach what their projected manufacturing quantities were. So this has created a lot of frustration, shortages, and problems. That's the main issue, but we have also seen in some countries logistical challenges getting vaccine from the center to the periphery. I believe, and you're absolutely right, within WHO, we do know, for example, within the COVAX facility that has gotten commitments to receive 2.2 billion doses to distribute to Gavi-eligible countries like Zimbabwe. Not all these doses are going to be available immediately. In fact, the vast majority of these doses are going to become available towards the second half of the year. Now, we know, for example, here in Zimbabwe, that Zimbabwe is not banking on one source of vaccine. They are looking at Gavi, they are looking at African Union, and they are looking at opportunities for bilateral arrangements with other countries. So again, I really would like to second the recommendation that Shingai made earlier this evening about the Ministry of Health having an opportunity to share as much of the information in terms of what is projected for sources. I can speak, with authority of what is coming through COVAX because that's being WHO, but I cannot really speak with authority for vaccines coming from the other platform. So I think the Ministry of Health and Childcare is in the best placed position to share this information. And as you rightly point out, as this information is made widely available, it will cut down the opportunities for jumping the queue and things going wrong. Thank you.
Alex, I'd like you just to clarify something for me. Are we talking here about a cure or a vaccine? People appear to be mixing up the two. Could you clarify that briefly, please?
So we are talking about a vaccine. A vaccine is the one that's given to people before they get sick. to prevent them from getting sick. And what we are seeing with some of the vaccines that are already in use, should they become infected, their risk of developing severe disease and dying is very much reduced. So this is a preventive intervention. A cure is what you give after somebody has become infected to get rid of the illness. So this is a prevention. The vaccine is a preventative measure.
And Alex, I do want to ask you a last question, a final question, and then also Shingai. But the Federal Drug Administration in America has not approved the vaccine. This is a question from one of our viewers. Thank you very much for this. It's only been authorized for emergency use. That means that the FDA may be uncertain about its effects. Is that a true comment?
Thank you very much. This is a very important question. So when we are in emergencies, there are two ways in which vaccine can be authorized for use in the population. As I mentioned earlier in the program, once a manufacturer goes through the recommended steps, provides the data from the different trials to regulatory authorities, like the FDA is the regulatory authority in the United States, or other people that perform that function, including WHO. There are two ways this could come out. One, the data meets the requirements of safety and effectiveness. And this can be listed as approved for use in an emergency situation. That's the emergency use listing that we are talking about. And because of the time, and I think Shingai mentioned this earlier in the program as well, because the time, the amount of data that we have, the period that we have, what is possible at this time is that emergency use listing. I must emphasize that before any regulatory authority can issue that stamp of authority that this product can be used in this emergency, it must meet those critical cutoff of safety and effectiveness. Now, when we have longer data and longer periods of data and everything, then we go to another process within the WHO system. We call this pre-qualification. Again, either of these processes allow vaccines to be used safely in the population. So the viewer or the listener who made that question is right. What we are using now is the emergency use listing, but this does not mean that the vaccine has any shortcomings. Thank you.
Thank you very much for that question. That was from one of our viewers from the diaspora. We do appreciate you getting involved in the chase this evening. Shingai, I'll ask you, Shingai, and then Dr. Laborde, I'll finish with you. But Shingai, if a citizen gets vaccinated, does this mean that the existing COVID-19 protocols, such as wearing a mask, observing social distancing, and of course, large gatherings, falls away? Because I think people believe that once they get the vaccine, it will be back to life as normal. Is that true or not?
I think, as Dr. Alex has just mentioned, most of the vaccines that have been rolled out, the endpoint was, as in when we talk of efficacy, they were talking about preventing severe or moderate to severe disease, and measuring the level of antibodies that the participants were generating. So in short, well, maybe to backtrack, there are some vaccines which, are called sterility. They totally prevent development of the disease. So far, the COVID vaccines they mitigate the effects of the infection. So they don't eliminate, they don't stop you from getting infected. The virus will enter your body, it will replicate, but what they've shown is, so far, they prevent you from getting moderate to severe disease. Some of the other vaccines, the Oxford vaccine, from what I understand, has also shown some benefit in cutting asymptomatic transmission, which is a positive. So on top of preventing progression of the disease, the secondary studies have shown that there is some element, some benefit to cutting transmission. So having said all that, the short answer is no, the preventive measures will not fall away because people will still be infected. So the masks and the hand washing will remain in place. The benefit that should accrue is mainly to members of my association, and that the numbers who are going to be admitted and the pressure on ICU beds and the pressure on people requiring oxygen and all those kinds of in-hospital treatments, that those numbers should decrease significantly. But again, if you're talking of a population of 10 million, if we all suddenly throw off our masks and start attending football matches, we might
we'll have a chance of a third surge, a third wave. We're actually managed to get Zimbabwe's Deputy Minister of Health and Childcare, Dr. John Mangwiro, back. Dr. Mangwiro, I did want to ask you two very specific questions. One, of course, is the official government position on whether citizens of Zimbabwe will pay for the vaccine. And the second question is that if you do get the vaccine, does it mean that existing COVID-19 protocols, such as wearing a mask, observing social distancing, and large gatherings will fall away? Your response to those two questions.
The vaccine will be free to Zimbabweans. If when the vaccine comes, it doesn't say now we can enjoy ourselves in nightclubs, go to football matches, and go to funerals or go to churches in our thousands, because the vaccine does not prevent you from spreading the virus to others. So we need those protocols to remain intact: social distancing, putting on of our masks, sanitization, and all the precautions that we should be doing to avoid getting this pandemic on the road again. So in short, the protocols will remain. We even make them much more tighter, and we are going to make sure people are aware that the vaccine is not a silver bullet to not getting the disease. So we will keep those must be observed continuously, and as government, we will continue to make people aware together with what you are doing. This is very commendable, in that people know that the vaccine is not going to prevent you or getting to carry the virus all over the shore.
Thank you. I think that's a very important point. So beware, citizens. Even though you may get vaccinated, it doesn't mean that you have to abandon COVID-19 protocols. You still have to wear a mask, observe social distancing, and of course, you cannot attend large gatherings, funerals, parties, as the minister said, go to nightclubs or football games. Dr. Laborde, you have the final say. Do you have any final thoughts or comments on the COVID-19 vaccine, safe or not, and what is the plan? Your final thoughts, ma'am. You have to unmute again, Dr. Laborde.
I was going to say my final thoughts are that the vaccine is as safe as any other vaccine. It is as safe as there is no drug. In fact, I saw Prophet TB Joshua. He put up a very important statement on which he said, no matter, he was telling look, he's got almost 50 million followers. He said, get yourself vaccinated. He said, I have reacted to chloroquine. There is nothing in this world that will never give you a reaction. So we are better off being vaccinated, and pray. We just hope that we will not get as severe complications as we are anticipating or anxiously worried about. And the vaccine is safe indeed. And please, can the minister advise also the heads of state that medical aids in South Africa are actually are participating in the purchasing of the vaccine. Minister, earlier before you came, I mentioned the issue that I think there isn't enough money to be able to vaccinate the nation. So let's not lie to ourselves. And let us not hope that our partners will immediately they'll bring the vaccine after they've vaccinated their own people and completed their own stadiums. So we also should be trying to find some domestic funding here somehow.
Thank you for that. I had thought we had dropped Sekuru Sibanda off the call, but apparently he is here. So Sekuru Sibanda, you will have the final word. What would be your final thoughts on the vaccine, on COVID-19, the plan for the vaccination rollout, and of course, is it safe or not? Your final thoughts, please, Sekuru.
Yeah, what I think with this vaccine, we should not. This vaccine is only for prevention; it's not a cure. So people must not relax and say, no, it's done. No, people should get vaccinated. And also, I would like to urge also those people who are also saying, talking about traditional herbs. Please, people must stop buying traditional herbs from those people who are selling the herbs in the streets. They should go to people who know how to use these herbs. If they get visitors in other offices, they will be told how to use these herbs. Yeah, I know people are very keen to use the traditional herbs, but it's not that they must also learn to be vaccinated. So we encourage people not to relax when you have been vaccinated. That I know I'm done. No, you will still be spreading. It's not a cure. Yeah.
Thank you.
Yeah.
Thank you. We have come to the end of our show. I hope it was informative to you as it was to me. I'd like to thank our guest, Dr. John Manguro, Zimbabwe's Deputy Minister of Health and Child Care, Dr. Alex Gasasira, WHO Country Representative, Dr. Ruth Labode, Chairperson of Zimbabwe's Parliamentary Portfolio Committee on Health, Dr. Shingai Nyaguse Chiurunge, President of the Senior Hospital Doctors Association, and Prince Mutandi, or Sekuru Sibanda, Secretary of Education at the Zimbabwe National Traditional Healers Association, ZINATA. Many thanks, ladies and gentlemen, for appearing on The Chase this evening.